Hello and welcome. Today we're diving deep into a neurological disorder called chronic inflammatory demyelinating polyneuropathy, or CIDP. It's a mouthful, but we'll break it down and understand what it is, how it affects people, and what can be done about it. The exact cause of CIDP remains elusive. It's believed to be an autoimmune disorder, meaning the body's immune system mistakenly attacks its own nerve cells. While genetic predisposition might play a role, specific genes haven't been definitively linked. Factors like infections or certain vaccinations have been proposed as triggers in some individuals, but more research is needed to confirm these connections. CIDP's impact stems from the destruction of myelin, a fatty substance that insulates nerve fibers, called axons. Think of myelin as the protective coating on an electrical wire. When myelin is damaged, nerve signals are disrupted or blocked entirely. This process, called demyelination, slows down the transmission of electrical impulses along the nerves. Inflammation further exacerbates the damage and contributes to nerve dysfunction, leading to the symptoms we'll discuss shortly. Unlike Guillain-Barré syndrome, which is acute, CIDP is chronic, meaning it develops gradually over at least 8 weeks. CIDP is considered a rare disorder. Estimates suggest that it affects between 1 to 9 individuals per 100,000 people. It can occur at any age, but is more commonly diagnosed in adults between the ages of 40 and 60. Men are slightly more likely to develop CIDP than women. The symptoms of CIDP vary from person to person, but they typically include progressive weakness, especially in the arms and legs. This weakness often starts distally, meaning in the hands and feet, and then progresses proximally, towards the torso. Numbness, tingling, and pain are also common sensations. Loss of reflexes, particularly in the ankles and knees, is another hallmark. Some individuals may experience fatigue, difficulty walking, and problems with balance and coordination. In severe cases, CIDP can affect cranial nerves, leading to facial weakness, difficulty swallowing, or vision problems. The symptoms of CIDP develop gradually, differentiating it from conditions with sudden onset. Diagnosing CIDP involves a combination of clinical evaluation and diagnostic testing. A thorough neurological examination helps assess muscle strength, reflexes, and sensation. Nerve conduction studies are crucial to evaluate the speed and efficiency of nerve impulse transmission. These studies can reveal slowed conduction velocities and conduction blocks, indicating demyelination. Electromyography, or EMG, assesses the electrical activity of muscles and can help identify nerve damage. A lumbar puncture or spinal tap may be performed to analyze the cerebrospinal fluid, looking for elevated protein levels. In some cases, a nerve biopsy may be necessary to examine nerve tissue under a microscope. CIDP presents in several subtypes, but classic CIDP is the most common. Other variants include distal acquired demyelinating symmetry, or DAS, which primarily affects the distal limbs, multifocal acquired demyelinating sensory and motor neuropathy, or MEDI-SEM, also known as Lewis-Sumner syndrome, which affects multiple nerves in a non-symmetric pattern, and CIDP associated with specific antibodies. Each subtype may present with slightly different symptoms and require tailored treatment approaches. There's no cure for CIDP, but effective treatments are available to manage symptoms and improve quality of life. The primary goals of treatment are to reduce inflammation, suppress the immune system, and promote nerve regeneration. Intravenous immunoglobulin, or IVIG, is a common treatment, providing antibodies to modulate the immune system. Plasma exchange, or plasmapheresis, removes harmful antibodies from the blood. Corticosteroids, such as prednisone, are another option, but their long-term use can have significant side effects. Immunosuppressant medications, like azathioprine or cyclosporin, may be used to suppress the immune system in the long term. Physical therapy and occupational therapy are essential for maintaining muscle strength, improving mobility, and adapting to functional limitations. As an autoimmune disease with an unknown cause, there is currently no known way to prevent CIDP. The prognosis for individuals with CIDP varies. With appropriate treatment, many people experience significant improvement in their symptoms and regain functional abilities. However, some individuals may have residual deficits or require ongoing treatment to manage their condition. Relapses are common, highlighting the importance of long-term monitoring and management. Research is ongoing to better understand the underlying mechanisms of CIDP and to develop more targeted and effective therapies. Studies are exploring novel immunomodulatory agents, such as monoclonal antibodies, and investigating the role of specific immune cells in the disease process. Advances in diagnostic techniques, such as improved nerve imaging, are also helping to refine the diagnosis and management of CIDP.